presentation on my cue.
Good afternoon, everybody. I'm Paul Gilson, along here with Elliot Wong and Ian Mackey. We're Polar Bear Consulting and Consultancy, and we are here to discuss Mindset's Access Our Medicine initiative. To get you up to speed a little bit on the background of this initiative, up to date, Access Our Medicine's goal as an initiative is to introduce universal, affordable healthcare to people all around the globe. In order to do this, Mindset's goal is to push a petition forward to the World Health Organization in order to make affordable healthcare a two-way conversation all around the globe. In order to make that petition, bring that petition into the public eye, Mindset said a couple of things along with this Access Our Medicine initiative in order to bring it into the public eye. One of those things is putting the petitions on websites such as Care2 and Change.org in order to expose it to people who browse those websites, as well as partnering with organizations such as the AIDS Foundation in order to bring together people who are experiencing the problem of unaffordable healthcare at high costs. To date, Mindset has seen a lot of success in getting the petition numbers up to its goals. The goal for April 7th this year is to have 100,000 signatures, and they're at 92,000, over 90%. So that goal, I think we can all assume, is going to be met. But we know that Allison has bigger goals for this organization. She wants 1 million signatures by 2016 on April 7th. And so we know that this strategy is working so far. It's getting Mindset to where it needs to be in terms of petition signatures. But there has to be something more to augment the current efforts in order to reach that goal of 1 million signatures. And so we've analyzed a series of alternatives to try and figure out what is it that's going to give Access Our Medicine that extra push to get those 1 million signatures. Among all those alternatives, we've considered several that are listed here. Across the rows are the different ways of reaching out to potential signees, and in the different columns are different ways of analyzing those different methods of reaching out, from greatest to least importance. A full moon indicates that the potential solution performs well in that category, and an empty moon means that it's not very strong in that category. I'll give you a moment to look at it if you so please.
Where's the existing strategy of paying for signatures?
So as far as paying for signatures goes, so do you mean through Change.org, for example, and Care2? So that's something that we haven't put on here just because we want to consider what additional strategies are being considered. But
so is your recommendation, what is your recommendation for continuing or not continuing with Change.org this month?
Yeah, absolutely. Just given the success that there's been to date, we recommend continuing with Care2 and Change.org. As far as cost, we see as $1 to $2 is a pretty reasonable amount to pay per signature. And if it's already gotten almost 100,000 signatures, we don't see why those methods could continue to be successful.
Is that reflected in your budget when you show us your budget?
Let's see.
You don't have to skip to your budget.
Okay, yeah, well, sorry, we'll talk more about that later. But as far as the budget goes, mostly what we'll be looking at is the new strategies, but we can talk about that when we come to it. So as far as the consideration of alternatives goes, we've got a lot of different potential options here. When we're looking at, but the one we focused on was it was NFC interactive engagement, which is near frequency communication. So what this means is transmitting shortwave signals to cell phones, for example. And this has two main advantages. One of those being the ability to engage people rather than just get them to sign the petition and forget about it. And the other one is the ability to perform analytics with the data that's received from it. And so the way this would look is, for example, you go...
So you jump, we're a small organization, they go from a web-based strategy to an NFC-based strategy. How do you expect the organization to acquire the skills in order to do that?
In order to acquire the skills, I'm sorry, can you repeat the question?
Sure. So using NFC technology, it sounds like a great idea, very innovative, but for a small organization that may not have the deep technology skills, how would you recommend that they make that leap from a strategy now based on web-based technologies to a strategy based on NFC-based technology?
Yeah, absolutely. I think the way we see NFC technologies is a marriage between kind of a physical advertisement and a web-based technology. It's a way to bring those two things together. So I think this diagram might help illustrate my point a little bit better. And if your question isn't answered, please let me know. Basically, the way this would work is you have a billboard, for example, something that normally people would just walk right by. but the idea is to make it attractive to the eye, something that someone could walk right up to and put their phone up to it, and then immediately their phone would jump to the website where the petition is, and they can sign the petition. As far as the analytical capabilities go, this basically the information, basically the phone would transfer information to the sticker, and then the sticker would transfer information back to the phone and onto a database. And there are a number of different database technologies that can be used to analyze this data. I think Elliot would probably be able to speak to that a little bit better than I.
Yeah, I think just to answer your question in terms of this organization being able to handle something like near-field communication technology, the great thing about near-field communication technology is that as it's matured over the years, it's become extremely both accessible and affordable. One example that we came across was that an elderly woman was able to attach near-field communication stickers to her spice jars and set this all up for herself, so that when she took her phone out when she was cooking, she could scan one of those spice jars and it would automatically go search the internet for recipes that she could use to cook that evening. It's really, we don't believe that it's something that it wouldn't be able.
But it doesn't mean that you target high traffic areas, so you need people to walk by something.
Yes, absolutely.
So what's your strategy to find those high traffic areas?
Yeah, basically our strategy for high traffic areas is putting this in major metropolitan subways. So, and that would be in North America primarily to begin with. So experimenting in Toronto, for example, perhaps New York City, areas where there's a large number of people coming through a very congested area and being exposed to a billboard like this. And we'll go through the projections later of how many people actually need to be scanning those things, but it actually turns out to be a pretty reasonable number of the people who really interact with this technology.
So just jumping right to your budget, looks like there's no funding in there for any kind of consulting for our team to really kind of wrap our heads around this. Looks like we're going to buy the gear and we'll do it ourselves. Is that the plan?
There's actually built into the budget. Apologies for not having it in more detail. It's accounted. Part of that will be.
Could you jump to slide 13 so the audience
can
also see the budget?
Yeah, part of the price for receive transmitters is $65 each. Near-field communication technology stickers, which what they call them now, are actually extremely cheap. You can get them as cheap as 10 cents a piece. So built into that price of $65 is the price that it would cost to pay a developer to separate.
Okay, so even so, there's no money. This, as far as my basic understanding, Matt says that's about 11 months, and then we'll chew through our whole budget. Is that right? And then, and there is no consulting fees in there, and there's also no money left for the change.org, which you said.
Yeah, we will touch on this a little bit later, but one of the main strengths of this campaign is the scalability. So we're going to recommend a pilot program and test out the technology. And what's great about this is these costs. You have, say, one ad space, one transmitter. The costs are roughly the same as if you have 50. So, but per unit. So, from a scalability perspective, we're going to recommend you're going to pilot this program, see how it works, see how effective it is, maybe alter a little bit based on that data, and then continue to roll it out. So, it's not like we're going to put forward all $500,000 Canadian in your budget and blow through it. If this isn't working, we're going to know very quickly in line with your fail fast policy.
And to add, just to respond to the part about change.org and Care2, for example, if this does prove to be a more successful and cost-effective strategy, so if you're getting a better return on investment, you're able to attract people to sign at maybe 50 cents a piece, then that might be a signal to a month or two in the future to scale back on Care2 and change.org and perhaps not interact with those sites as much, because those sites have been proven to be 5 times less engaging than the actual Access Our Medicine website. So it's flexible. If this proves to be successful, then we'll spend more money, and then you can spend more money on it. If not, we can scale it down.
Yeah.
And have you considered the cost to create the powerful ads? Like we've got ads please. Who's creating the ads that are so compelling?
So we go back to the slide previously. We just quickly mock this up based on your YouTube video. So we believe you already have the messages necessary. You already have the actors or whoever are reaching these videos. Actually mocking up the advertisements should come at a pretty low cost.
Absolutely. So to move things forward a little bit, I think we've given an idea of what it is exactly we're proposing with this near-field communication. And so as far as the recommendation as a whole, it really has 3 parts. It's who are we targeting, who are we trying to get to sign the petition, and then what is the channel? How do we communicate the message to them? And then lastly, over time, how is the number of signatures going to grow, and how is the budget going to look? And so as far as the audience, we propose targeting millennials in major metropolitan areas, starting in North America. Then, as far as channel goes, NFC technology in subways and transmitted through smartphones. And finally, over time, we see this reaching 1 million signatures and staying below the budget of $500,000 Canadian. And now Elliot's going to speak a little bit more to, in particular, why we chose this audience to target.
So millennials are a lot of things, but what's most important to us is that they're civic-minded, they're socially influential, and they're microshares. This is really important because this makes them a great audience for our message. Civic-minded means that they're individuals who believe in doing the right thing for the right reasons and doing it the right way. As socially influential people, they love to get together with their peers, share their thoughts, and really appreciate them. And ultimately, as true children of the internet, millennials are microshares. This means that they excel at things like liking comments and sharing photos, or something simple like signing a petition online. So we believe that we're going to be targeting an audience that's going to feel extremely comfortable, as well as they're going to be great ambassadors to our message. So, and here, we decided we would target millennials based off the level of smartphone penetration in their demographic. Here we're looking at Canada and the United States, and we can clearly see that they are the leading majority in terms of smartphone penetration. And as they begin to use smartphones in their day-to-day lives, we even see them using them on the go. So for example, if someone walking to work through a subway station, I'm willing to bet that they're either on their phone or they have it somewhere nearby.
City pilot. How many signatures are you anticipating you're going to get in that 1 month, 3? Yeah, for the 40. How many signatures am I getting for 45,000
a month? Yeah, I can touch on that. So honestly, we didn't really know how many signatures we were going to get in a 1 month span. What we did is we calculated what % of people you would need to really engage with your advertisement over the course of a 11 or 12 month campaign in order to reach that 1 million. That's only 1.3%. So if you are hitting 1.3% of people every month, you're going to be on track to hit your 1 million signature goal.
Sorry, 1.3% of people walking by each installation?
Yes.
And how do you know how many people are going to be walking by the installation?
Okay, so what we did there is we estimated based on, so like we said before, we are recommending you put in subway stations across major metropolitan areas. What we did is we estimated the foot traffic that would pass through each one of these subway stations on a yearly basis. Again, one of the real strengths of this campaign is its scalability and the analytical capabilities.
So did you base your assumption based on the daily foot traffic or the number of unique visitors per year?
We did the daily foot traffic, yes.
So we can only get 1 signature from a person.
Yeah, that's
and if they go by the same subway station every day, we can still only get 1 signature.
Yeah, no, absolutely. And that's why, again, the analytical capabilities of this NFC technology is going to be huge. If you just had a poster without this technology up there, you would never be able to measure if that poster was leading to signatures. With the NFC technology, if you see after maybe 2-3 weeks, people are no longer interacting at the same level as earlier in that poster, let's switch locations, go to another subway station.
So you haven't put that into the budget, right? So you've got these NFCs scattered in 3 major cities where none of our staff is. We have no travel budget, we have no consulting budget for anybody to actually go and identify that a subway station in New York is moved so that we should go and move one of our 30 beacons that we've invested so much of our hope in.
Yeah, I mean, I see where you're coming from, and that is going to be one concern. But I think it's great to look at this from a comparison point of view. So if you just put up physical advertisements, you would have all the same problems, just you would never know about them. With our technology, or with our proposal, you're going to have that immediate feedback of, is this working or is this not working? And yes, you will have to say bought in maybe for a month, or however those advertisements work. You will be able to move it to another location after a month.
And in the case where it is not working, if that is the case, what's plan B?
Are you talking about the individual advertisement or like the whole strategy? Overall, we think, well, first of all, we are confident in our recommendation, but if it was absolutely not working and we tried moving locations and again, nothing was getting the response rates we were looking for, we believe it would be time to revisit those alternatives. But additionally, one area that we were really excited about but just couldn't quite get the same response as this campaign is through a referral program. We think over the next couple of months, we hit your 100,000 signature goal. It would be great to leverage all of those people to have them promote the word to people who they know are also passionate about this cause.
So I've seen similar campaigns, but done with QR codes. Did you look at all the new technologies implemented, and why did you go with NFC over something like QR?
Yeah, so with QR codes, we definitely all see them around, but I think it's rare that someone would pull out their phone, open up the application, and then scan this device, and it may or may not scan. The great thing about NFC technology is it's simply just a touch. You don't need a second. You don't need to ask the customer to go download the app. They don't have to take any extra steps. It's immediate, it's quick, and it's easy.
So how do you translate loop tapping to a signature?
It's the tapping. The tapping would initiate the connection to the. It's the tapping that initiates the communication with the application server. So it's from there that your phone would contact the server. It would walk you through the process of signing up. You would get a name. You would give a name, city, and an email address. And in return, in the database, it would store you as a unique identity.
What I'm getting at is this is no different than me going to a website, browsing the website, and still not signing up. So the fact that I tap doesn't mean I'm going to sign up.
No, not necessarily. But what we believe is that with the right continuing, the social media campaign on the side and raising awareness, is that those individuals that are going to go out of their way to take that one extra step of going to touch their phone, it's likely that they're someone who's at least moderately interested, and hopefully as they browse the material on the site, they become even more interested.
And on that, just following up on that, Michael, the population we're targeting here, millennials, is actually where we've had the worst conversion rate. And our strongest conversion rate has been with people over 50. And by your target, those are the folks who are less likely to have an NFC experience. And also, I guess you're de-addressing a lot of the population. They're going to have to be millennials with an NFC in one of these 3 locations. It would be very difficult to scale this internationally. And for a program that's definitely about signatures, but more than that, it's about awareness. It's very narrow. It feels very narrow.
Is there a question?
No, I shouldn't.
So just moving forward, we addressed how we wanted to implement this project in pilot testing phase. And the way we went about determining which market would be most attractive was evaluating these 2 criteria. One being level of spending on healthcare. Because we all know that affordable healthcare is becoming a much bigger topic and a bigger issue, we think that if we find people in these demographics that are experiencing these issues themselves, they're going to be much more likely because they have that personal connection to the issue and they're going to want to act upon it. The second criteria we used was ease of entry. Because this is a pilot testing phase and we understand that there are financial restrictions related to this operation, we think taking unnecessary risks at this point wouldn't really be advisable. So moving forward, the United States and Canada we think would be the safest options. So again, I'm sure you guys know we've been talking about NFC technology. And yeah,
Yeah, so just since we're running low on time, I just want to go ahead and wrap everything together, and if there are any last questions, we can try and address those if possible. Again, we're at the main focus.
Question, go back to the very first slide. You started talking about healthcare. Do you want us to change our focus from affordable medicine to just healthcare? Are we broadening the scope of this campaign to healthcare in general?
I think that it's important with a campaign like this to keep the scope limited. I was looking online at some of the petitions over time that have garnered 1 million signatures, and those that have in general are usually targeted towards something specific, like blocking a bill in particular, or just not an issue as general as healthcare. It's hard for people to get behind that and feel connected to that, and so I think it's key in order to say, affordable healthcare is the key. We want healthcare to be affordable. If people in general are just thinking like I'm just signing this because healthcare, it's hard for them to really understand like what it is that they're behind.
New research campaigns that were able to get millions of signatures, did any of them use NFC technology?